Hi, Bill. Welcome to Digital Health on Air.
Hey Dave, thanks for having me.
Yeah, of course, of course. For the audience, I just want to formally introduce you, Bill Citro, Senior Director, Experience at OrthoNebraska, one of the highest performing, um, health businesses that does remarkable things for the community. Many humans are more comfortable today because of the awesome innovation y'all have done throughout the years. Just really compliment you. Your background is amazing. You have a dual perspective as both a technologist, as a patient advocate, as well as just having that marketing bone in you. And so this beautiful Venn diagram, I think, helps you generate and create both practical and innovative solutions. And the last thing is obviously, one of the things that Bill, I think, wakes up every day with is, hey, we're in a really competitive market and we need to provide a differentiated experience. Because at the end of the day, you can have a successful outcome, but if you don't have the successful experience, then the long-term outcome might be compromised, or the caregiver experience might be compromised. And I just really compliment you for being a leader in that. For the audience, Bill recently joined us at our Leader Summit for our Oracle Summit Day in Chicago, and was very well received as both a panelist as well as a thought leader. So, Bill, thank you. Thank you for giving us time on your afternoon.
Well, thank you. I know, and everybody who knows me knows that I love to talk, unlike some people in IT. So, that's what makes doing things like this pretty fun.
Awesome. Well, maybe probably the easiest question for you would be, tell us a bit about OrthoNebraska. Tell us about why the patient digital experience is so important to the business and also important to you.
Yeah, I think it's helpful to understand Ortho Nebraska as we get into some of the more, detailed parts of our conversation. Ortho Nebraska, we think of ourselves as a specialty health system. So we do control the continuum of care, or cover the continuum of care is this big buzzword in healthcare, right? It's about, starting when even before they walk in the door, right? That's the digital experience, all the way through when they pay their bill, essentially, is how we've looked at it. And so far at Ortho Nebraska, that means for us, yes, that digital experience is where we're going to focus today. But I think where we deliver a lot of the value is the services between when you come in to see one of our orthopedic physicians, and then physical therapy, imaging, ER, especially that imaging piece, because one of the places I think a lot that a struggle is turnaround times to get things to imaging and then back into clinic and to know what to do about it. Whereas where we know that we're 50% faster than our competitors in the market in doing that. So that's a really big operational advantage for us in the way we're set up, where we have a clinic site and a hospital all together, all focused just on orthopedics. It allows us to drive some of those operational results. So think of us as an orthopedic, little mini orthopedic health center, especially hospital, and then those other services I talked about.
I have to think that innovation has been significant for the patient experience within the community. Maybe share an example or two of how different it is when you go and you have this ability. You mentioned 50% speed, and speed to somebody either in pain or wanting to get on with their life, or get the answer to an important question. Tell us how that feels to be able to deliver on that.
Yeah, I'll try to make it very tangible, because I just heard an example the other day, not my family member, but someone else's family member said, they went to some other place in town a few years ago, the typical workflow, typical situation. You get hurt, you come in, you see somebody, okay, now you're waiting for your MRI to get authorized. And now, okay, that's 3 days. And then, okay, now they schedule you 2 weeks out. Okay. And then then you get your MRI, then you have your MRI, have your MRI results, wait a week to get back to see the physician. We're a month and a half now. In Nebraska, that happens in 2 to 3 weeks because we have our own imaging. We know how to pre-cert that really well. We actually we schedule it. We do a different workflow where we wait till it's pre-certed and then schedule it, but our turnaround times are within 24 hours for MRIs, which is unheard of at any kind of larger health system. And so that really allows us, that it's really that imaging piece that's key, and then being able to pull all those levers to make that happen internally, that tight control over all of that to make that happen.
That's an amazing story. Yeah, I empathize. I've had two neck surgeries. I've had 2 ACLs, and I can empathize with the length of time that first to get answers, then to see somebody, then to get clarity. And so that's amazing for your brand.
Yeah, it's frustrating as a patient, right? To just be like, hey, I'm just waiting for weeks to get an answer here, just waiting for the next thing. Like that next thing could be days instead of weeks. That keeps that momentum going, and you feel like, okay, well, I'm making progress. I mean, look at our tagline's journey on. Like it's like about feeling like you're on that journey and you're not getting off track. The plan is happening. We're moving forward.
So this is a great segue into your background. You mentioned this elite consumer experience that you're bringing. And nothing against awesome physicians that are well trained and wonderful surgeons, but I have to think that this combination of your background of marketing and understanding that value is defined by the receiver, not necessarily the sender, maybe share a little bit of how your journey led to your ability to inform these sorts of awesome innovations, which are, if you think about in healthcare, what's always hard is to make the patient smile, to make the business entity smile, and the provider smile. Usually whenever there's something that gets put in the middle of that Venn diagram, somebody's frowning. And when you describe what you've just described, I think it's smile, 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 because the business performance is better, the provider's having more consistent throughput, there's a lot of continuity, and then the patient has a tighter set of expectations. So maybe walk us through, because I have to think that your background in marketing and your ability to think about the consumer has informed this. So maybe take us through that story, because I'm sure there's some nuggets in there.
Yeah, no, I there's a lot to unpack there. First off, that feels like a big question. I know we're trying to talk a little bit about my background, but yeah, I do think when you can take that smile, 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 you want to get it, right? Like those are your clear wins. I think, and we talked a little bit about this at the conference too. I mean, not just you and I, but others. What I've come to realize is sometimes it's smile, smile, frown, but then that frown eventually becomes a third smile. It just doesn't happen right away. And that's what I've kind of learned is if you can get 2 out of 3, you're doing pretty good. It's kind of like time, cost, scope with project management. It's kind of a similar philosophy, right? You can probably only pick 2 out of 3. If you can get all 3, go. But my background, really honing in on that patient experience side, or I've done lots of on the marketing side, I've done like lots of website focus groups, and really I feel like have a very strongly internalized sense of what patients value. Of course, that does shift over time, and so that's actually something I'm constantly wanting to do. I think a lot of people are like, oh, we'll just hire a research firm to do that. I really don't believe in that. I like getting my boots on the ground and talking to people, and talking to our patients, so I can understand what's really happening at the ground level, and actually transitioning, like switching from marketing to IT. Sometimes I'm working on rolling out some new piece of software or project, like a new Luma thing, like mobile check-in or whatever, and I am And then I take that time to talk to those patients. Hey, how did this go? What did this do? I don't say, oh, access staff, tell me how it's going. I want to go there and see for myself as well. So I think that that combination really puts me in a nice position to be able to do some of these projects and really understand it from that side as well as the patient side as well as the staff and the business side.
So it leads me to a question about your experience with your patient portal and investing in that, but realizing that this important experience couldn't be facilitated with a portal only. Definitely important, but needed more to generate that experience. Maybe give us a glimpse into how you came to realize that, because there's definitely lessons learned. I mean, Cerner is wonderful in the fact that they're bringing so much innovation to the market. They clearly are innovating their portal to up-level that experience, but still, I know that you're a big believer in that alone isn't going to deliver what you need it to deliver when you think about patient experience in relation to money. So maybe take us through a little of that, because I think that would be really beneficial for the audience.
I think the big thing that I just learned about patient portals is it's in the name. They're portals, and they're fundamentally, from a technology perspective, designed to be closed and locked down and secure. Secure is obviously a good thing, but the closed and locked down pieces are hindrances to us when we're trying to have a digital front door, right? We're trying to, online scheduling, for instance, before Luma, we turned it on in our patient portal. I think we had 9 patients use it a month. You know why? Because we don't do a good job of driving people to the portal. They really only use it for a handful of specific functions. But B, new patients can't use it. You have to, it's a high commit. I mean, even if you develop a workflow where somebody is essentially joining the portal before how many people are going to join a portal before even if they know if they're going to make an appointment? That's just not a realistic ask of a potential patient, right? So that's really the big limitation. And then if you try to bifurcate it and say, well, we're going to do this for new patients, but this process for current patients, that gets really difficult to manage. And you're essentially buying 2 sets of technologies with the same feature functions. So that's why something like Luma is great, because it has both the security side, but it's also very accessible to new patients. And so that was really one of the primary reasons. I know this is an infomercial for Luma, but that is one of the things that we're like, oh, our portal can't solve this problem, but Luma really can help us solve it.
Yeah, and there was great discussion around the difference of what you're describing, that you're solving with a solution like Luma really being an orange and a portal being an apple. You can't really compare the two, because what you gain out of a portal is a very different set of experiences than what you can gain when you're wrapping a technology that is interacting with various steps of your patient journey. Maybe talk a little bit about that and how you think about that experience.
Yeah, we think about the patient. I mean, like we kind of talked about before, we think about the patient experience in terms of the stages, right? And for new patients, we're really trying to lead with, we are easy to get into. I mean, that's kind of talked a little bit the image thing, but it's really just ease and speed. Is kind of what we even in our branding, we try to communicate that simplicity, ease, speed, to allow us to differentiate in the market. And the life cycle of the patient is sort of no different. In orthopedics, we are a little bit different in that we're fairly episodic. I mean, that was another thing that I learned in speaking with a lot of patients. I literally had patients tell me to my face, I would not follow you guys on social media because I saw you when I got hurt, and I do not want to think about you because I'm not hurt right now. And I said, fair enough. It was just such an interest. That was just like a very aha moment for me, because it was like, okay, we could take really good care of people when they're hurt, but they might not want to be thinking about us all the time. And that's a very different from the traditional healthcare mindset where I came from before, which before I got to ortho, which was, capture, retain, they're going to, we come to us for primary care, they're going to come for us for cardiology, nephrology, whatever they need. Right. And so, yeah, that we think about the patient, we have to win that patient every time. Now, obviously, we deliver a great experience, which we think we do. It makes that easy to have them when they have another need 2, 3, 4, 5 years down the road. I think the data on average I was just looking at says the average person has an orthopedic incident once every 7 years, roughly. Again, the average person, some are going to have a lot more, some are going to have a lot less. But yeah, we think about it in that context that and when we think about our overall strategy, it's also, when you're young, you come capture. That's another reason why digital front door is important to us, because if you're young, you're probably come to see us because you're a weekend warrior and you went a little too hard, or you went a little too hard at CrossFit or whatever it is. But then, you're going to come back and see us when you're 60 and you need a new knee.
Yep.
So that's been sort of our long-term philosophy on patient infection or retention.
So talk to me then about, because I know that you had shared some unbelievable outcomes that, and again, grateful Luma is helping, but it's your program doing these things. It's not, I like to think Luma is a big part of that, but some of the data that you shared as it relates to the pain points, and how a digital first experience is making an impact, whether it's to no-shows, to wait times, to the same. Talk to us a little bit about some of that, because I think for the audience at hand, the measurement of these things is always very elusive and hard. And I think you have a lot of wisdom to share there.
Yeah, I think most healthcare organizations really underestimate the impact that moving to using a primarily SMS or text-based communication methodology is going to have on their operational metrics. They think, oh, if we start texting patients, that's great. Our younger patients will like that, and we'll get more younger patients. They'll want to come see us. They view it as more of a marketing thing. And what we've seen is that's not really true. That we do have actually a very decent amount of older patients who very much prefer texting. But really, what it helps drive is that many more texts are read than emails, and we all know that. But where you see that really come through is in those no-show rates, right? Because people are actually seeing the date, time, getting it corrected if they wrote it down in their planner or their calendar wrong, and getting to see us on time. And that helps us be so much more efficient in clinic when we don't have those unexpected holes in our schedule. And then, docs on a 3-4 week waiting list are really busy ones. And so then you have patient frustration and they seek care elsewhere, right? So anything you can do to move those people up, like Luma's waitlist functionality, which we're trying now and is going well so far. But even just the reminders are huge. So we have seen that our no-shows reduced from 4.5 to 2.5%. And that represents, roughly $20,000 in hard dollars in savings in a given month for us. But then there's also the provider satisfaction piece, which is harder to measure, but is very key there, because they don't like, patients not showing up. They just see it as productivity lost. So they see that. And then you talk about the smile. So yeah, there's that. And then also from a perspective of, outbound calls, making less outbound calls because of some of the features like digital call collection that Luma is able to offer us really and broadcast messaging in the case of provider offices, kind of a huge hidden impact there that we were talking about, with not having to, every time a provider cancels a clinic or is out, having to do a bunch of calls, and just letting that kind of come in through the day naturally instead of having it be this big event every time that happens.
Yeah, that's amazing. I mean, first of all, congratulations on that. I mean, it must feel good to be part of initiatives that bring the smile, but also the financial benefit is significant. Talk about the importance of referrals and how you see that investment, as referrals has obviously lifeblood of your business in many ways, to now being just a really important business channel that drives a metric. Maybe share with the audience how y'all are thinking about that, and what are some of the KPIs you're measuring, and what are you hoping to get out of it?
Yeah, so referrals are obviously important for really any business. We operate on a lot of word of mouth marketing, like anyone, really in healthcare. It's actually even maybe more pronounced for us on the consumer side. So we talk a lot about how we have relative to other healthcare organizations that be direct to consumer strategy. We call it direct to consumer because while referrals are important, we are not affiliated with any healthcare system. We are an independent entity. And so that means we need to differentiate that way. And what that means is that digital front door is even that more important. And referrals, we need to make those easy. So for referrals specifically, we're always looking for ways to make that easier. And really just so we see the KPIs around referrals in terms of what are our providers in the community telling us. It is a little bit harder to measure those. I won't lie there, but we think that referrals are really measured by how easy it is for people to get in.
Amazing. Well, I know our time went quick. I would love to ask you maybe to wrap up for two things. First is you are known in the Cerner community as an integration expert who has been able to successfully take and integrate world-class innovation into that Oracle Health experience. Why do you feel you've been successful, and what advice would you give to others that might be looking at a solution like a Luma or any other third party? What top tips would you give them that would help them to have the success you've had with Luma and Oracle Health?
I think it's, mostly around be ready to continue to evolve, right? I think the way that we thought we were using Luma when we first signed on is very different than how we're using Luma now. And so just be prepared to continually optimize and continually add on to what you're doing and find those little nuggets where you can draw more value. I think, roll up your sleeves and be ready to do that hard work to really please that imaging manager or please that, one set of physicians who have this problem they come to you and want you to be able to solve. And I think that's really one of Luma's strengths is Luma's pretty flexible and willing to, like, when they see a problem that needs solved and we can articulate it very clearly, they're kind of willing to chase after it with us, which I really appreciate. I would also just say that integration with your EHR is sort of a similar theme. It's an ongoing journey. Some things are easier to do than others, and it varies from EHR to EHR. But you just want to be prepared to really be a problem solver and spend some time chasing those things down. Some of your time limit will help too, but yeah, it's been a fun journey.
Well, to encapsulate your feedback for our community, it's your brand, Journey On. It's definitely amazing to see the work that you have led at OrthoNebraska and the accomplishments of being able to not be your the impediment of innovation, but rather the success of innovation. And I know that inpatient experience, at the end of the day, it's, can you put 3 smiles? You get the smile for the patient, smile for the business, and ultimately the smile for the provider. And I really compliment you on that. Thanks for taking the time. I know our audience routinely in the community will often interact and want more information. And I know you've always been so gracious to do that. And thank you for your time, Bill.
Yeah, thanks so much. If anybody sees this and wants to reach out and talk, I always love to talk. Luma, hey, what are you doing when that's working? What are you doing that I can steal from you and you can steal from me? That's all great stuff.
Amazing. Well, we'll see you soon at the next Oracle Summit, which I think is going to be either in December or January.
Illuminate too, right? So,
well, that's coming around the corner. Yeah, for sure. Well, thanks, Bill. I appreciate you very much.
All right. Thanks. You too, Dave. Nice talking.